Welcome back. In this video, we are going to discuss about compartment syndrome. Before understanding compartment syndrome, we need to know what is compartment. Compartment is the closed area of muscle groups, nerves, blood vessels which are supplying the muscles, and it is surrounded by the fascia. The pressure in the compartment is 5 to 15 mmHg. Let us see the cross-section view from the toes which is looking upwards. When you take the cross-section of this part, you can see the tibia bone, fibula bone. So you can see the tibia here and this is the fibula. We have the anterior compartment, the lateral compartments, and posteriorly, so in the front we have the tibia. So this is the tibia. And this is the anterior compartment near the tibia, and this way we have the lateral compartments, and then we have the deep posterior and superficial posterior compartment. So guys, anterior, lateral, superficial deep, the superficial compartment, and the deep posterior compartment. This is the fascia which is enclosing the components. In the white color you can see. So with this we understood what is compartment. Now let us see what's happening in the compartment syndrome. When the swelling of the muscle will cause a compression on the nerves and the blood vessels. So in the compartment syndrome, there is swelling of these muscles. The swelling of the muscles is causing a pressure on the nerves and the vessels. Now again you can see here the tibia, fibula, anterior compartment, deep posterior, superficial posterior, and lateral compartment. Let us understand the pathophysiology of this compartment syndrome. So, any insult or an injury will cause the congestion, the vascular congestion. Vascular congestion includes the microvascular and venous congestion. Because of this congestion leading to hypoxia. Hypoxia, reduced oxygen supply in the blood. And then what happens? There is cell death. Since the oxygen is not supplied, there will be cell death and protein release. Because of the cell death and the protein release, there is edema of the tissue. You can see the swelling. Okay. This is the normal leg, and here in the compartment syndrome, you can see the swelling of the leg. Increased intracompartmental pressure and further cell damage occurs, resulting in necrosis, and the person have to undergo amputation. So guys, you understood there is congestion leading to hypoxia. Because of hypoxia, no oxygen via the blood, there is cell death, necrosis, and protein release, which is leading to edema. And because of the edema, the fluid being secreted, there is increased intracompartmental pressure causing the cell damage and necrosis. Compartment syndrome is a special entity which is common in the legs, and it is also found in the forearm, thigh, and arm. It is a syndrome which is occurring because of the increased intracompartmental pressure within a limited space area. So now you know the intracompartmental components and the intracompartmental pressure being increased here in this syndrome. What is compartment syndrome? Here, let us see that the intracompartment pressure being raised to 30 to 40 mmHg will cause the capillaries to collapse, and the blood flow to the muscles and the nerves is reduced, and there is necrosis, gangrene, and finally leading to amputation. What are the causes of this compartment syndrome? There is a narrowed space due to tight dressings or a plastic cast left for many years. Lying on one limb in the comatose patient can also cause the compartment syndrome. Increased content with the compartment due to trauma like fractures. So you see that the contents are increased within the compartment, which contains the edema, the fluid increases. The blood flow is reduced, so there is edema, and this edema occurs because of the trauma, and the trauma like the fractures, edema, ischemic injury which is occurring. You can see the hematoma, poisoning after trauma, and burn injuries can also be a cause of compartment syndrome. This is a picture of the hematoma. It is oozing of the blood, okay, inside the organ. And then we have high pressure injection injuries, and like the gun injury, oil based material injury, extravasation of chemotherapeutic drugs, and snake bite. So guys, here they're talking about the high pressure injection injuries. They are usually the industry related injuries, like the grease guns, spray guns, diesel injectors, or the guns. Other guns can include the paint guns. All these plastic injectors and all these can cause a high pressure injury resulting in the compartment syndrome. And also the extravasation of the chemotherapeutic drugs, and snake bite can also lead to compartment syndrome. Let us see the features, the clinical features of compartment syndrome. It compromises circulation. So we know there is impaired circulation, and the functional mainly of the muscles and the nerves. So the function is compromised. The muscles and the nerves have a compromised function. It often maintains the normal color and temperature of fingers, and distal pulses may not be obliterated. So you can see the fingers and the pulse is not obliterated, and the color, the temperature of the fingers is going to be normal in spite of the severe muscle ischemia, because they are the most away, okay, the fingers are the most distal part. So first the muscles will be damaged, whereas the fingers, the color as well as the temperature will be normal, okay, they will maintain the normal color. And then pulse will also not be obliterated. The muscle ischemia, that is the reduced blood supply, if it is occurring for more than 4 hours, it will cause the muscle death. So there is a death of the muscle. This death of the muscle will increase a toxic substance called myoglobulin. This myoglobulin can enter into the blood and cause a damage to the kidneys. And this myoglobulin, if it is excreted in the urine, it is known as myoglobinuria. Irreversible nerve damage will develop if ischemia is for 8 hours. So it can extend up to the stage of damaging the nerves if this ischemia is persisting up to 8 hours. Now you can see this client's photo, and here this is the compartment syndrome, the cross section they have taken, and these are the blood vessels. And when these blood vessels are compressed, now you can see the blood vessels here being compressed, and the severe swelling will cause the compression of the arteries and veins and compromise the blood flow. With this you can clearly understand these are the blood vessels which are present, and these blood vessels are compressed. The pressure is being exerted from all the directions because of the edema, and this pressure is going to compromise the blood supply. Moving on to the clinical features, there is a progressive, persistent, severe pain which is aggravated by the passive muscle stretching. This is the diagnostic sign. When the physician does the muscle stretching, there is passive muscle stretching, and this causes a persistent progressive pain, okay, and this pain is aggravated when you do the muscle stretching. This is the diagnostic sign. The tense, tender regional lymph nodes will be very typical. The regional lymph nodes are very painful and they are tender, painful. Pulse will be usually normally felt in the compartment syndrome, but it may become absent if it is associated with the arterial injury. Unless there is arterial injury, the pulse will be normal, like we discussed in the previous slide. But once there is a damage to the arteries, if there is an injury which is cutting the arteries, the muscles, along with the muscles there is an injury to the arteries, then the pulse might be obliterated. Compartment pressure more than 30 mmHg is an indication for fasciotomy. We'll be discussing about fasciotomy in detail in the next upcoming slides. So you have to remember, when the pressure is exceeding more than 30 mmHg, we have to go for fasciotomy. The moving on with the features, it is common in calf and the forearm. So like we saw in the first slide, the compartment syndrome is common usually in the lower limb, along with that in the calf and the forearm. Closed injuries cause hematoma, leading to the increased pressure. So we know that hematoma is a cause for the compartment syndrome. This hematoma, oozing of this blood, will increase the pressure. If it is associated with the fracture of the underlying bone, which in turn compress the major vessels, further aggravating the ischemia. So you can see guys, here this is the limb, okay, and this was the bone. And if there is a fracture of the bone in this muscle, if there is a fracture of the bone, this fracture, the broken piece is compressing the blood vessels, causing a damage to the blood vessels. So the ischemia, the blood supply which is supplied, is obliterated. This fractured bone is here and it is obliterating the blood supply. Once there is a reduced blood supply, then you can see the signs of pallor, pulselessness. So the vessels are damaged here, so the pulse is going to be absent. Pain, paresthesia, diffuse swelling, and the cold limb can be observed. If the compartment syndrome is allowed to progress, it will eventually lead to gangrene. Ischemia ends up in gangrene, that is the death of the tissues, and the chronic ischemic contracture with a deformed, disabled limb. So guys, you can see here the anterior compartment, tibia, fibula, like we saw here, the swollen muscles which are compressing the blood vessels and the nerves in the legs. So you can see this, the same thing, just for the clarity, you can see these muscles which are compressing the blood vessels and the nerves in the compartment. And you can see the necrosis, the gangrene, the death of the muscle in this picture. The problems with the compartment syndrome, the infection, septicemia, abscess formation can occur. Renal failure, like I told you earlier, the damage to the muscle secretes the myoglobulin, which is a toxic substance, and once it starts accumulating in the kidney more than it is secreted out, once the accumulation is more, it will cause a damage to the tubular cells of the nephrons, and then there will be renal failure. The gangrene of the limb because of the ischemia, chronic ischemic contracture, disabled limb, Volkmann's ischemic contracture. So what is this Volkmann's ischemic contracture? It is the deformity of the hand. You can see in the picture here the deformity of the hand, fingers, wrist, which is caused by the injury to the muscles of the forearm. The condition is also known as Volkmann ischemic contracture. Hope it's clear, which is the damage to the muscles which is causing the deformity of the hand, wrist, and also the fingers. Muscle necrosis will release the myoglobulin, which is excreted in the urine as myoglobinuria, and this myoglobulin damages the kidney, leading to renal failure. So the same thing here they are saying, rhabdomyolysis, secreting the myoglobulin. This myoglobulin damages the kidney and cause the myoglobulin cast, oxidative stress in the kidney, inflammatory responses of the kidney, endothelial dysfunction, vasoconstriction, apoptosis, the programmed cell death happens, and then the acute kidney injury, acute kidney failure. For the diagnosis, we should not wait for all these 5 P's to appear because they are the late findings, but we saw that the pain with the passive stretch, the doctor or the physician or anybody stretching the muscles, it causes a pain and there is swelling, and the pain or the swelling, the pulse is absent, and there is paresthesia, pallor, paralysis, and all these 5 P's you have to remember, and this is for the diagnosis. Moving on to the last and the important part, that is the treatment of compartment syndrome. Compartment pressure will be persistently more than 30 mmHg. Now we saw that the pressure is persistently more than 30 mmHg. How do we measure this pressure? It is by placing a fine catheter in the compartment and using a pressure monitor. This is the indication for fasciotomy. So you can see here the pressure measurement. If the pressure is exceeding 30 mmHg or within it is 30 mmHg from the diastolic pressure, so we require the fasciotomy. If the 30 mmHg absolute or within 30 mmHg is the diagnostic pressure, this instrument with the clean catheter and also the pressure monitor, with this we measure the pressure. If it is more than 30 mmHg, we opt for fasciotomy. Adequate lengthy incision involving the skin. So here they are talking about the procedure of fasciotomy. You have to give a lengthy incision. The incision is involving the skin, the fat, the deep fascia. It should be done until the underneath the muscle bulges out properly. The multiple incisions will be made if it is necessary. The separate incision in each compartment should be done. So we saw the compartments. Why did we discuss about the compartments? So that you know where each of the compartment is there and how to give the incision. A lengthy incision in one of the anterior compartment, one in the lateral compartment, one in the superficial posterior compartment, deep posterior compartment to be given. So you can see the pressure which they are measuring here, and then these are the longitudinal incisions which are made in the muscle. The fascia is cut over the lateral compartment, reducing the pressure of lateral leg muscle. So with this fasciotomy procedure, we are reducing the pressure, and this is the normal anatomy, and this is the swelling of the muscles which is caused by the compression of the nerves and blood vessels. Fasciotomy is done in the forearm anterior compartment. It is a specific method. In the forearm, it is done in the anterior compartment. Carpal tunnel should be released by cutting the flexor retinaculum. So you can see here, this is the flexor retinaculum. Carpal tunnel can be released by making a cut on the flexor retinaculum. Incision will begin at the junction of the thenar hypothenar area. It is extending proximally, initially the transverse across the flexion crease of the wrist at the ulnar border. So you can see here. Then they are saying it is continuing across the forearm towards the radial side of forearm, and then proximally the forearm towards the medial side, creating a convex flap towards the lateral side. So you can see here, which is creating a convex flap towards the lateral side and moving to the medial condyle. The incision in the upper limb begins at the flexor retinaculum. Okay, this is the flexor retinaculum. It is extending into the forearm with a convex flap towards the radial side, eventually leading to the medial epicondyle of the elbow joint. Okay, so this is the characteristic pattern of fasciotomy which is done in the upper limb, the forearm. The treatment, the appropriate antibiotics to be given, catheterization done in case of acute renal failure, mannitol diuretics to cause the diuresis so as to flush the kidney, fresh blood transfusion if there is hematoma or hemorrhage, there is oozing of the blood, reduced blood. So if there is anemia, then we have to give the blood transfusion. There is hemorrhage. And hyperbaric oxygen. Here the topic talking about the hyperbaric oxygen. After doing the surgical decompression, this hyperbaric oxygen therapy is given. This will help in reducing the edema and also improves the tissue's vitality. So this is the picture of the hyperbaric oxygen. Thank you. With this, we come to an end of compartment syndrome. I hope everything is clear. If you like the video, hit the like button and subscribe.